Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications. I'm one of the MCs here at Gold Learning. I've had the privilege over the last couple of weeks chatting to all of my colleagues, friends, folks around the world in all of their different pockets, talking about Gold Tongue Tie Symposium. That's right, it's coming up really soon, and we want all of you to have the opportunity to meet, of course, our presenters and get a little bit of insight of what's going to be coming up. Today, I have the pleasure of sitting down with Dr. Jenna Davis. It's so good to have you here, Jenna. Thank you for joining us.
Oh, I'm so excited to be here. Thank you, Fiona.
It's great to have you back. I know how busy you've been. Lots of things, lots of life updates for you, the ups and downs of life that have been happening. I know, like for most of us, it's been like a hot minute, right, since we've been together. But you are still here, my friend, dedicated to this field, which is incredible. And you have a presentation coming up, Survive or Thrive, Unlocking the Brain and Body Impact of Oral Dysfunction. Ooh, we'll get into some of those things in just a moment here, but why don't you reintroduce yourself? Tell folks where you are in the world, what are you doing, and what does your practice look like?
Oh, thanks. And I am so excited to be doing this presentation. I am Dr. Jenna Davis. Actually a chiropractor by trade, and I am a practicing chiropractor. I have a full-time practice that is really it's a family wellness practice, but about 60% of my practice is now pediatrics, and a lot of those kiddos are under 2. And that is because there is, this continued understanding and movement of people really understanding, "Hey, if we can actually be a little more focused on prevention or early detection and early correction,
Mm,
that's going to change, their experience and their life experience." And so that's why we're seeing a lot more, I think, increase in that pediatric field. The other piece that is a huge passion of mine is really elevating the level of care of our pediatrics and our families worldwide, which I think many of the individuals, or actually probably all individuals who are on this, and signing up for this symposium, that's really a passion for theirs because we
mm,
see the need, we see that issue. But what I really love is connecting all the different parts together and really looking at that whole person. And so that's where that oral function comes in because so many of us are stuck into our focus. So we get laser beamed and we're only focusing here, but we're forgetting actually that entire body and brain connection to that oral function. And so
mm.
I've created some different techniques over time. In 2016, I created the PIPS technique, which is pediatric intraoral palate specific technique. It's
Right.
an assessment and a technique. And that's really the whole idea behind it is looking at not just if there's a tongue tie, but tongue function, pediatric
Mm,
PMD, the palate, which is actually connected to the sphenoid bone, which is connected to all parts of our skull, and the top 2 vertebrae in our neck. So
mm.
all of those things come together, and over time, that's where I've really been diving deeper into its impact with airway, with, development, with learning, with movement patterns, and with our posture, and so that's part of what I'm going to hopefully bring to this event.
Love, love, love. I was just as you were talking, I know all the incredible things that you have done and what you've contributed really to this, field of medicine. I remember back in the day, Jenna, when I was recommending that that families take their babies to chiropractors and how hesitant I was to say out loud because of the response that we were getting. I will tell you a full circle moment is when I met with some clients yesterday and I said, "How are things going? What are you doing?" And they're like, "Well, we're seeing our chiropractor every week and it's just phenomenal." So, isn't it incredible where we started from and where we are today? And I would say to folks out there, if you're not utilizing, chiropractic care in this field of tongue tie, it's sort of underserving at this point. Our families are doing incredibly well, and the improvements that we're seeing is just phenomenal. So thank you to you because I feel like you're a pioneer really in this area. Um, and it's taught, practitioners like me how to, communicate that to our families to make sure that they're getting that whole body, and then all that nuanced care that you're giving as well. So big shout out to you, Jen. I just love it.
Thank
Yeah.
Oh, thank you so much. I think I mean a lot of us have been kind of trying to break down some of these barriers and increase that level of understanding. And there is always a lot of fear when it comes from lack of knowledge or lack of communication or improper communication.
Yeah,
And so that has definitely been something that I've been trying to share is the importance of that collaborative approach and how there can be overlap with different professions, but it doesn't mean that
absolutely.
one is going to be the key because every individual, every baby, every child, every human is actually different based on their compensation patterns. So we have to find the right team for that family to help unwind all the pieces that are needed. And that is the beautiful piece about symposiums like Gold's Learning because that's what it's focused on. It's focused on how can we network, how can we learn from other
Mhm.
professions that is only going to change the level at which we can serve.
Yeah, absolutely. Yeah, and I think you just hit the nail on the head there, talking about bringing people together. That's why we do love Gold and the symposiums when we bring, all the collaborators together to voice what's been happening and give us those updates. Let's talk briefly about your PowerPoint because I know people will want to know what you're going to be talking about. So, again, the title is Survive or Thrive: Unlocking the Brain and Body Impact of Oral Dysfunction. I was very pleased to see that you're going to be talking a little bit about their nervous system, which is one of my passions as well. So tell me a little bit about, what we can expect. What inspired you to sort of, look at all of these aspects of sort of the whole body and then the connection between the things that you've been learning. So tell me just a little snippet about what we can expect.
Well, I'm trying to target all the pieces. So for those who really want that research, there's tons of research in here that's going to be cited and you'll get references. So there is a lot of research out there. It's just not always research in the profession you might be looking for. So there's tons of dental research that actually supports cervical curve and position of our jaw. So TMJD or TMD. There's tons of research that is actually coming from a neurodevelopmental standpoint of how the tongue can be linked to impact to the, um, the firing of the cortex. So your
Right.
brain firing, it can be linked to our balance and our posture. Athletes, there's actually tons of research coming out now about performance improvement with that proper tongue position. So one of the things I'm always diving deeper. I'd love to say I love sitting on a beach reading just relaxing romance novels, which I would love to do, but I can only handle that so long because I love just learning more and understanding more and seeing all the new pieces of research that are coming out. So, other pieces that you can expect, I am going to talk about the nervous system
Mm.
and its connection to the tongue. I am going to talk about compensation patterns that will answer some of those questions of, okay, we've done everything we know how to do at this point, but we're not quite getting there with this family or with this baby or with this child. Hopefully, coming away from this, you might have a couple great aha moments of, okay, I'm going to
Right.
go home and try that with that family, or I'm going to look for a person who does that if you don't do it or it's out of your scope.
Mhm.
I am going to be diving into even how the tongue function is linked to some of our learning, linked to some of our retained primitive reflexes, which is a huge other passion of mine because it is all connected and really impacting the way some of our younger kids, all the way into adulthood, how you can thrive in your world. And so those are some of the key pieces that I'm going to be discussing. Oh,
Well, that's fantastic. Thank you so much for sharing that. And I know you're going to inspire so many people to really take sort of relook at it. That's what I love about you, actually, Jenna, is that sort of translation of knowledge and, just again, the representation of, everyone that's involved, with our families, and what they might be able to sort of take away clinically and put right into practice.
exactly.
So lastly, as we wrap up here again, the title of your presentation, Survive or Thrive: Unlocking the Brain and Body Impact of Oral Dysfunction. And I did hear you say, in your last answer, just talking about, how those things, the long-term impact, which is really, I think, what a lot of families are looking for these days is, they need to know, that the investment that they're making has these long-term impacts because that helps them, sort of, look forward as they go through this very intensive sometimes period in their lives. But as we wrap up this session today, can you just tell me, something about your experience? I think I want to know, because I know you see families all the time, as you mentioned. But really, what is some of the takeaway that you've gotten in the last little while, just working with families as you've gone through this research again? What has been inspiring you as you've worked with families?
So it's honestly the changes you see, especially the earlier that you can be working with those little ones, there's less time that they've created these compensation patterns because they create these compensations starting in utero. It's not just from the birth process. And so the sooner we see them, the faster these changes happen. And so I love some of the takeaways that I see are, or the, I guess, I like to call them little miracles because the brain and that body connection is always like a miracle to me. Even though it's based in science, that doesn't mean that's not miraculous. Is the poo fairies that come all the time. These babies who are struggling, having bowel movements, and just by releasing that interference or those traffic jams between body
Mm,
and brain and body, which does start with also working at that oral function, allows them to have better digestion.
mm,
When they leave after coming and having a session with us, and the babies almost like power down and they have this really long nap. And that's where you can just see that brain is needing to power down so it can help with all of that rewiring that's happening so
yeah.
quickly. When you see a family and they're saying, no matter what, my child is just not able to crawl. Like they're just not able to pull those knees up. And then by the next time you see them, which could be in a week, they're all of a sudden on that hands and knees and just how quickly this changes. And for me, that's altering not only for that baby or that child, but how that family is able to interact with their child, how they're able to enjoy this experience because it is a long journey. And the final thing I just want to say is honestly, when that family comes in and says, I saw you, I've also seen my osteopath. I went back and saw my IBCLC, and we've had another consult with a oral care provider or a dentist, and how everyone is speaking the same language and we're able
Mm.
to collaborate with each other. That is our ultimate goal, I think, for many of us is just if we can all start speaking that same language and really respecting that and supporting them continuing down that journey that is working for that family, that's amazing to me.
Yeah, absolutely. I couldn't agree more. That is something I think we're very driven to see, and that's why we keep showing up. That we're not going away. We want to make sure that we continue to see the improvements there, and that collaboration. Well, thank you so much to Dr.
You
Jenna Davis. Thank you, Jenna. It's been great having you here today, and to all of our friends listening in, you can head over to the website right now to goldtonguetie.com to get all of the details on this symposium, get up to date with what's happening. You can check out, of course, Jenna's presentation, Survive or Thrive, Unlocking the Brain and Body Impact of Oral Dysfunction. Thank you again, Jenna, for joining me here today. And to, again, all of our viewers, thank you for joining us. We'll look forward to seeing you online. Have a wonderful rest of your day. Bye bye for now, everyone.
bye.